Audio?
Yeah, sorry.
Okay, can you see me now? Hear
I
me?
can see you. Can you see me? I think my screen is frozen up. It's froze, or I can. You can see me moving.
No, no, no. It's your screen is frozen up.
Why? Why so, baby? Uh-huh.
It's clear now, and we are already in live. Audio is not clear by audio. Audio is not.
Oh, now it's fine.
Okay, yes.
Great.
All set.
One sec. Niharika. Niharika. ये फोन ले जा.
Okay, for 2 minutes.
You will send me another link, na?
No, no. We can only connect two people. That's it. Just me
No. So
and you.
you will
That's it.
send me a fresh link, or we'll continue with this link only.
It's we are already in live. You can just go ahead. That's it. We are already in live.
Ravi sir, I'll call you in half an hour, sir. अरे हंसो मत. Seriously. Okay.
Right. So first, welcome to our show, and good to see you on video because we've been talking for a very long time on the phone and text messages. I have not seen you almost like close to about 2 years. We had a long relation during the time of NMC, Gazette, challenges, difficulties, everything we have gone through, all the phase. Now being in the industry for almost like another 20 years, I'm in Chennai, and you've been in the Delhi for several years, guiding the students and giving a proper information and everything. I have few questions because we call you in our association. I don't know whether you know this name. We call you Rocky Bike. You know that meaning?
No, 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 no.
Because I don't know whether you watched a movie called KGF. I don't know, like if you watched a movie called KGF.
Yeah, yeah.
From
KGF, yes,
from
definitely.
from all the way from Bombay, Rocky Bhai come to Bangalore and go to into the KGF. Similar way, you based in Delhi, but you are the first person to knock down in NMC Gazette issues and NMC office on various aspects, even the Gazette challenges, going from smaller level court to a higher court and then Supreme Court and challenging each and every people. And still, you're a superhero for many students and parents. Do you know that at least? You have
I don't
lot of
consider to
students are
myself to be. I don't consider myself to be hero. It is just see it all came naturally. The only thing is, you as a counselor, me as a counselor, we resonate with our students, right? And when we recruit a student, we take the complete onus. When a parent come to us now, we give them a pledge that after this, the way you are, giving your child to us, we take care of his responsibility. And suddenly, this NMC Gazette, see, we don't have any problem with the government regulation and rules. Government is bound to frame rules for the goodwill of the country or the people. The problem is clearly probably in the execution framework, right? And that is where, it came so drastically, there was a clear panic amongst every student, right? Because ultimately every student was severely impacted, and the way this regulation was impacted clearly questioned the intent behind implementing this regulation of National Medical Commission. So, I should not mince my words over here, but I clearly say that the overall fault or the clear the crisis which was created was purely done by the National Medical Commission, right? And especially, see, we were primarily connected with Philippines, right? Because I was recruiting students, I always have belief in this beautiful education system of Philippines, right? Like, I've been traveling to almost majority of the countries, but Philippines has always drove my attention, and the satisfaction level of our students was always very high. And the only thing with this gazette was this was implemented in a retrospective manner. Never ever in the history or in any judicial parlance it is being there that any law comes, it is for the future, right?
Future.
Yes, you implement a law or a traffic law or any penalty law, it is for the future. You can't say that this law will be implemented from 2 years behind, right? And everyone will be impacted. So this was something which clearly was very, very ill concepted by the regulatory, just with a mindset not to cleanse the education system, not to sanitize or ease out the medical facilities, but with the mindset to desist the student and to clearly obstruct them from whatever education they have always already been pursuing. Okay, so it is nothing like you are planning to do, so you do this thing. It is we have already gone to Philippines, and now they presented, or not with Philippines, with every country. Even the students in Ukraine are suffering badly, right? See, I remember this Ukraine Russia war happened, right? And the students in the same class of the batch, some student went physically to Ukraine before 18th November. Classes are same. Some students went 18th November after, to study physically. But ultimately, everything was before 18th November. So some are into the Gazette. And by virtue of Gazette, they cannot take transfer, right? So the students,
According to according to the
according to
gazette.
an NMC FMGL regulation, so student, what were they asking for? That see, this war is not under control. We went, we spent all our money, right? We have very limited resources. Just give me a permission to take a transfer because putting going back to Ukraine is putting our life at risk. And this NMC came in the Supreme Court and they made an official statement that these are substandard students with poor marks or poor NEET scores, right? And that's the reason they're going abroad, right? So this is something that is really, that really shook me as a counselor, shook you as a counselor. It is not about promoting any particular country. It is about how you are mistreating a 18-year or 16-year-old child who just came out of his, education, is dreaming. He's aspiring to have a beautiful career. And by virtue of that thing, students have to again go back to Ukraine in spite of all the odds. So the question is about the sensitivity of this government. How sensitive are we towards our students, whom we say they are gonna be the future doctors? So see, Ghani bhai, this is all about this whole mess up that is happening in Indian medical education as of now, which personally speaking, we all responsible counselors will resonate. This is not good for the future of our country. It's clearly in a bad shape. In fact, I'll tell you, most of the people who are not in the NMC, they are not even aware. Even I was talking to some senior members in Indian Medical IMC, right? This fraternity of doctors, IMC, right? Indian Medical. So they were not aware. I told them this. They were really surprised that this is happening to our future generation doctors. So, anyways, problem is big. I don't know. We have you were there with me in High Court also. Personally, you have witnessed multiple hearings, right? But ultimately, the justice was not delivered, right? And NMC is very sharp. Eventually, they camouflaged the case. They went to Supreme Court, and how it's a long story
O-
back.
Over the night. Over the night.
Overnight.
Over the
Overnight.
night.
So it is like they are not working as a responsible regulator. They are working as a, as if we are fighting in the streets and we are doing a very, very, mockery of this education system, especially medical education system. So I am not a rebellious by nature. This I am a very, very a very, very light-hearted person. But this series of events since last 3 years, they've actually, changed my personality as a person, right? That I've become more rebellious. I've become more, like I don't know what. Yeah.
Okay. Now I have a personal question. I don't know, like it's just a personal question. Okay. Now do you feel that because every NMC board member, they have a time tenure duration for the jobs or responsibility, whether you say it's a president or a chairman or secretary, they have a certain time frame, maybe like 3 years or 2 years they work in that position, correct? Then they get transferred. Do you think that if the new team members took over or new team members will take that position, Do you think that NMC will consider or revise or any chance, just an experience, because you've been there for several years, you knocked NMC in various way, you went across, you had several meetings, just an idea, what do you feel
See,
in
I tell
general?
you, see, personally speaking, I believe this is not a academic. I mean, I don't know. Like I'm putting these statements; these are very strong statements. How will the government react to it, or how will the people react to it? But I am open with my thoughts, right? But I believe these are not academic appointments; these are more of political appointments. Okay, and when you have political appointments, then definitely there is a clarity. There is, the people out there share a common vision, right? This is the goal. Our goal is either to actually create a merit based education system, or our goal is to propagate a particular thought process or propagate a particular lobby of medical institutes, right? There's a difference between two things. So is it drive by certain perception, or it's a neutral drive to create opportunities for our students? Why? See, why the students are going abroad for medical education? They're not going by choice, they're going
Yes,
by compulsion. See, a student, the dichotomy of Indian medical education system is a student who has even the 550 ka NEET score, right? In India, he the minimum education cost that will come to at the 550 score is not less than 60 lakhs. Not less than 60
minimum,
lakhs.
minimum,
That's a
minimum,
minimum. The minimum
minimum.
fee structure is by Kerala or Karnataka, and that's a minimum. And this year, to you know how the NEET cutoff has shot up like anything, right? So 60 lakh for a UG education. Just think it otherwise for any other program, BBA, hospitality, masters, any UG program. It is like in this cost, you are actually going to first world countries like Canada, Singapore, Malaysia, right? And over here, you are spending that much in India itself. So by compulsion, they are forced to go. And then NMC says, when we met the NMC people out there for Philippines, we got an opportunity. Uh, so when these BS students were affected, right? That how much is the total cost of education? We said the total cost of education is about 35 lakhs. So how much the BS students have invested till date? We said around 15 lakhs. So 35 minus 15 is 20 lakhs, right? So 20 lakh is still that they have not spent in the Philippines, right? And yeah, they will spend eventually. Okay, let them
Because
come back to India.
they make the payment, split and make the payment.
Yeah. So the argument or the point that came from their side is let them come to India. There are so many BDS seats, so many BMS seats which are lying vacant in India. Why do they want to go abroad? Right? Let them fill the BDS. So then we stated that right to education is a personal right. Right? If I want to pursue medicine, that's my personal choice. And why do you want to push me for BDS if the seats of BDS are left over? And the seats are left over because there is no cohesive healthcare, or I'll say awareness about the dental care, right? So
It's
this is
not that
the
there is no future also. See,
no
one more thing
future.
today, parents also say, if I'm investing 4 years or 5 years of my hard-earned money for my son's or daughter future, there should be a return on investment. So
See,
that is one of the
yeah,
reasons where our children not interested in taking BDS.
we have seen in our medicine program in Philippines, because it used to be a 4-year program, there were so many doctors, Ayush doctors, BAMS doctors, who were going to pursue the 4 years medicine program, modern medicine program, just because they are not getting that kind of recognition which a modern medicine doctor or MBBS doctor gets in India, right? So what to talk about BDS? So the coming back to your question, I was just reading one article also last week that was stating about the Philippines education, how they are changing the regulation. So the last line of that article said Dr. Srinivas, who's the secretary of NMC, that if even if Philippines comply to our norms, say if they remove the reciprocal agreement, still, we will what we will see, then we will see if the curriculum is matching with our curriculum or not, right? We will see if the 100% matching is there, and then we will decide whether it is complying. See, now this curriculum matching is something you it is like you are on a traffic red light and a traffic policeman want you to screw you, he will screw you on anything. How can you expect a foreign country to introduce yoga or introduce naturopathy in their course curriculum, whereby there is no concept of yoga, right? That's an Indian concept. So these are very weird regulations. The people out there are very weird. They are not, I don't know what kind of push mechanism they are being driven through, but this is certainly not good for the medical education system, especially of our country.
Okay. Now I have a question. Okay, we talk about complete information about Philippines. Now, what is the stake in Russia? Because Chennai, we have a lot of students in Tamil Nadu. The students they have an idea they want to plan to go for Russia. What is your idea in terms of Russia? Because I have done several videos in my channel. You have done separately videos in your channel. We both have did a videos in our regional language. You are more good in Hindi. I was in Tamil. So a lot of comments I've been getting in my inbox said, why don't you do a video in English? I thought of it's a chance for us to interact with the right person instead of me addressing by myself in the video. I thought of it's an interaction between you and me, and you're an expert in overall in terms of when it comes for medical education abroad. And because you own a company called Get My
Get my
University, and you
university.
have various contacts and connections. So tell me about what is your experience with Russia, how they comply with the new regulation guidelines.
See, the NMC is very when they drafted the FMGL regulations, they put forth very critical condition, right? And the condition citation is clause 4B of FMGL regulation that stated that a student, if he want to come back to India and practice allopathy, he needs to be registered, means and licensed, right? So that there are people who are confusing registration or license, but clearly it is that you need to get the license from the regulatory body of that country, which gives license at par with the local citizen. Now, this is the regulation that has created panic or massive discomfort to all the countries, most of them, because countries are not in a favor of giving license. They believe we are here to teach you, but not to give you license to practice in our country, right? You asked me a question about Russia, right? Because Russia is the mother of all the CIS countries, right? Be it any country, Kazakhstan, Kyrgyzstan, Georgia. So everything starts from Russia. See, I'm not saying what it's my personal belief. What I am stating is because this is my interaction with the people who have came out from Russia, and they were like they have came back in 91, 92, early doctors of Russia, right? So they know the hierarchy of Russian medical education system. In India, we have a concept of MBBS, like the general medical practitioner. In CIS countries, they don't have a concept of a GPA, right? They have a concept of specialty doctors, right? So without a specialty specialization, which we get after our PG education, let's say medicine, like gynecology, ortho, whatever, dermatology. In Russia or CIS countries, a doctor can only practice if he has completed his post-graduation education. Before that, there is no provision of granting a license, right? I now the problem with Russia is Russia before the regulation, it is clearly teaching is saying and the education system is they have a 6 year education system. So for 6 years you have to do your medical education, which will have clinical, non-clinical subjects, and the system is designed like that. Every year, whatever subject you study, then you have to go to the hospital and you have to do some training, right? Suddenly this gazette came, and the gazette also have one more condition of getting 1 year of internship.
Internship.
Yeah. Now, after this intern, and that has to be a separate internship. The way the internship is pursued in India, you complete your education. See, conceptually, internship is one thing. When you complete your education, you gather all the experiences, learning, and then you experiment with your clientele, with your either with your patients, right? So suddenly, this Indian embassy or the people in Russia started saying that 6 year education we will include 1 year internship also,
Yes,
right?
this is where I want to ask a question because the students being misguided or the parents being misguided by the local counselors or consultants, whatever we name, they say now Russia you have only 5 years of medical duration. So we follow the NMC norms and 1 year of internship can be given. So the total duration, including in the internship, is 6 years, which actually I know it's not right. So that's what the question. If I instead of me telling in my own channel, I want an expertise to answer. That's the reason I've requested you.
I have written to Indian embassy in Moscow several times. I have several communication with them, trail of communication, and I have cited NMC's FAQs, which was shared by NMC FAQ for clarification of FMGL Gazette. There was a question number 18, if I'm right, in the FAQ that what is the difference between a clinical training and a clinical internship? NMC states there's a clear difference between clinical training and internship. A training is something which you pursue while doing your course, right? Internship is done after the completion of the course. So what Russia has is a clinical training. 6 year, including internship, is a clinical training. It's an
Which is
integrated
part
thing.
of the curriculum. You
It's a
mean to
part
say
of
which
the
is part of the
curriculum. It's a
okay.
part of your learning process, right? But after you have learned the thing, then you have to do the internship. So what they're saying is internship is clearly not internship. It is a clinical training, right? And NMC, in my personal communication also, we have done that last year. We've written clearly to Mr. Shambhu Sharan, who was in National
The
Medical
chairman,
Commission, who's still there. Yes, not chairman. I think he's at a key designated
registrar,
position.
if I'm not wrong, registrar.
Yeah, yeah. So he stated
Registrar.
that we don't accept this internship as internship. So for the students who want to go to Russia or any CIS country, particularly, don't want to name it, but definitely it's not going to be 6 years of education. It is gonna be 6+ year of internship. One more confusion which
It,
Russia has, one more confusion that Russia has, that there is no concept of internship. Internatura they have already banished a couple of years back. So ultimately, the provision will come to doing the PG, right? So there is no clarity. When I wrote to Russian embassy, Indian embassy in Moscow, citing this FMGL rules or the FAQ, they clearly avoid my question number fourth and fifth, which was based on the clarifying about this thing. So again and again, they were answering first question, second question, and fifth question and sixth question. I again shot back that I think, and I again wrote back to them. I think you have missed my two questions. Please give me a clarity. Then again, a wishy-washy reply came. So that is the response, or that is the attitude of the Indian embassies.
they thought it's a multiple choice question. They can skip the questions whichever they don't want to answer.
So see, I mean, Ganibhai, there's a lot of confusion, not confusion, manipulation. I'll not
No
mince my
clarity.
words.
Actually, it means a no clarity. See, what is
See,
my pain and struggle? See,
yeah,
when we started our company or you started your company, the ground level is not just getting the admission and sending the students to abroad. You are
yes.
there until they graduate and come back and they get registered in the state medical council and then they become an independent doctor. So that is what the end-to-end service that we've been doing. But what currently the situation is going through, there's so many students being misguided, misguided. Why I don't understand. The NMC is not in a position to come up with a clear notification which are the countries that at least they can't say that you can go and study, but at least to a certain level they can give us another one more set of guidelines.
They shall come up. In fact, I have filed a petition in Delhi High Court, but somehow the drawback was that was filed in my personal capacity. So NMC lawyer simply, pacified the
Denied.
High Court that there is no locus standi of the petitioner, so it could not succeed. But the ultimate thing is, see these students, and see NMC has also given an alert on 8th of August 2023. And the alert
Yes.
is very severe in nature. The alert is saying that even if you are having a slightest variation in internship, duration, training, we will not grant you the license to come back to India and practice allopathy. And you will be the person who will be responsible. There's no second person responsible, neither we, neither embassy, neither consultant, right? So if a student is responsible, there is a clarity. And the regulations are so confusing because in the regulation in NMC FMGL, you are citing Graduate Medical Act 1997. Now, who in the hell will go to study one regulation, then correlate with another regulation? Why this confusion is being there? So that is the very, very wrong approach of our regulator.
In fact, you also shared in your channel. I also shared that our former health minister, Dr. Manshuk Mandaya, said in the parliament very clearly regarding this new FMGL Act. If the student doesn't have the license registration, we will not allow them to practice in India. That was a statement also given very clearly. I think you also shared in your channel recently as well. I've gone through that also.
See, we have to understand people are trying to play around and juggling behind the words, right? As per their comfort, right? But we have to see what is the intent behind these regulations. The intent is what Mandavia said, you very right, that students are not allowed to practice in the countries where they are pursuing their education, and they are sent back to the country, right? And these are the colleges with very poor infrastructural resources, right? Then why as a country India should accept these students when that country where the education is being provided, they are not touching, allowing to practice in their country? We will never allow. It's simple like that. But still, people are playing between registered or otherwise, And I'm not talking about small consultants. I'm talking about I'll not name anyone, the biggest consultants who claim themselves to be the biggest one. And when I countered them after 2 years of the regulation, some lady is there. She said, though, I was having a confusion. I was not aware about or otherwise. Manika, you claim to yourself to be one of the biggest consultants, one of the most ethical ones, and now after 2 years, you say you are not aware about these regulations. So, see, there's a lot of manipulation, but we are not supposed to blame the agents. The problem lies in the regulator, right? The problem lies in SEBI or RBI, right? That how they are creating a robust mechanism to defraud these regulations, right?
Right. So at least one thing that you have clarified about Russia. Now I have another a very long discussion. I want to discuss what is your opinion with Georgia, because there is three different the notification that we received from the embassy. In fact, the recent one also what we received on June 27th. It's been written by Mr. Arup Mukherjee, the recent one, and then the previous one. They also clearly says the Georgian education system is actually 6 years is minimum, and they have a licensing exam. The licensing exam they have to write in Georgian language, if I'm not wrong. And then there is a confuse between a junior doctor, and they're saying that you can work legally, and then within 1 year you get a license and you can come back. There's not going to be any problem with the NMC new guidelines. That means that even the Georgian embassy in Delhi, they have given a notification saying that the Georgian universities follows the NMC guidelines, which is actually not true. You know very well.
See, the confusion, I personally attended a meeting with the rectors of three biggest universities of Georgia. I think last month
It was
itself.
in Delhi.
It was in Delhi Park Hotel.
Okay.
And they all presented they have shared their presentations, how this, that, our universities. I asked the very simple questions, right? That you are on Indian soil and you are recruiting Indian students. And I think that was a meeting whereby I think 100 consultants were there, right? So, and I believe everyone in this room is very responsible, that will not do any unjustifiable thing. Indian government is asking to get the license to practice, right? We are not blaming the education system of Georgia. You must have a beautiful education system, right? And we're not questioning your system also. But are you complying with the norms of the regulator of India, which is asking for the license? So then our reply came from their side that our education ministry is recognizing their education, right? It is giving them the right to practice as a junior doctor. Manika, see, there's a difference between a right to practice and the license to practice, right? I can have a right to drive after 18 years of my age, but I cannot drive without having a valid license in my hand. Give me that valid license. At what stage are you giving that license? No, our education ministry is accepting again that wishy-washy. Manika, please be specific. When is a local Georgian student being awarded the license to practice? Then the reply came when he completes his post graduation in medicine, right? Postgraduate diploma. Okay. And Manika, what? Then I asked, like, who is the body which give license? Is it Ministry of Education or Ministry of Health? So Ministry of Health. So Manika, now tell me, when your local student is getting the license to practice after postgraduate residency, how, in what capacity are you saying that our student will get license after 6 years? Right. Number two. Number three, you are equating a MBBS doctor with a junior doctor. Please don't do that. Right. That is very, very unfortunate that you don't have a clarification or the basic definition of a comparison between MBBS. You don't use it as per your suitability. A junior doctor has an independent charge whereby he can do his OPD, he get into a hospital, or he can run his private practice. He's not supposed to work under any supervision. A junior doctor in Georgia is working as an intern. He has to work compulsorily under the supervision of a specialist doctor. So if your country it does not have a confidence on your junior doctor to administer the patient independently, in what capacity are you comparing him with our MBBS doctor? So that is also a falsified approach, right? So they were baffled. There was a lot of commotion
They,
in that.
no, they never no, they never expected they will see you actually.
I asked them, the organizer, not to invite me, but they insisted you have to come. I said you will do a self goal, but they did it. So you see, the point is that whatever they are trying to manipulate, Georgia is a classic example. Then they sat with me, these four guys, 2 o'clock in the night till 2 o'clock. They said, "What can we do? Suggest us something." Manika, either you make
This is
ramifications.
this is the sorry, sir. This is the university team sat with you or
University rectors of
rectors?
Georgia. So then I said there are only two ways to do it. First is you write to NMC. Then he said we are writing to NMC. NMC never respond to our questions or emails. Manika, okay. Manika, second thing is you change the medical act of your country, right? Because the way Philippines has done it, right? Though they've taken some time, but finally they could do it. They have audacity to do it, right? And it takes a lot of challenge for a country to amend the medical education system, just in case to assist our existing students. They said we cannot do that because we are bounded by ECTS regulations, European Council regulations. So we have a lot of treaties with other countries. We can. It's not easy for us, and then there is no solution to that. Whatever you are doing, even the Georgian embassy in India issued an advisory that was clearly filled with factual errors. They didn't. They didn't never mentioned a single piece of line. What is the practice about license? They were said we give you right to practice as junior doctor. So it's just self boasting yourselves, chest beating, and last me saying that we are completely compliant. First of all, who's authorizing you to say what is your legal authority to say that you are compliant,
Appreciate.
right? You are just a embassy. Your role is to communicate. You cannot serve verbatim to you that we are complying, self praise, which is wrong. Then I talked to Arup Mukherjee over a call. I asked them, the Indian embassy in Yerevan, who represent Georgia. He said, no, we are shocked. We are not very, because as per our information, as per RTI and the formal advisories, Georgia, the licensing is based to do a PG education, right? Then in what capacity embassy of India and Georgia and India is writing that? So they will get it. We'll get back to you. That's a simple question, sir. There are thousands of students who are being recruited for Georgia because after Philippines gets shock after this FMGL, Ukraine got shocked. All the big mighty consultant they jump to Georgia, right? And these are the set of private institutions. Also, tell me, these are cluster of C20 medical colleges, small medical colleges. They have taken almost so many student transfer cases from Ukraine. They are recruiting 15,000 or 10,000 students, 5,000 students each year. How will they teach these students, right? What kind of infrastructure they will give? So there was no clear answer, but somehow I understand, you understand. So I asked them that what if I pay my fees as a parent, I lose my money. Say embassy does not have any role in that. Embassy is just working as a communication mechanism, right? So it's okay. So things are going in a very, very wrong manner. But I believe someday an NMC or any regulatory body will come and they will clarify these things.
No, because if not, there won't be an end. See, somewhere something has to be done. See, we are like a lifesaver of students' future. So no doubt about it. When we talk, when we tell the truth, actually the students understand to a certain level. But you and me are the actual most wanted villain by the some of the Georgian consultants or agents. I don't know whether you understand this meaning or not.
Yeah, yeah.
And coming back again, I just this is the one thing which I just want to clarify. If with your current experience in the communications, what is the actual duration in Georgia? Is it 6 years or 5 years? Number one.
See, again, what they are playing around is under the ECTS credit system. That there is a 360 ECDS. So it's like a flexi program. If you are very talented, you can do it in 5 years and then 1 year internship. It does not work like that, right? A credit in India also we are getting credits. In Philippines there is a credit system, but there is no flexibility that you are fast enough so you just write down the papers in 2 years and you will be awarding the degree in 2 years. It does not work like that. Just a clear manipulation or representation of facts to curtail down the duration. So I'm not very unclear about the internship. This internship internship, right? So 6 plus internship, number one. And number two, the biggest problem, even if a student say that I want to go to Georgia, how many seats are there for post graduation? There is no, naturally. The post graduation seats are clearly based on the hospitals, right? The way we have MDMS seats. So in MBBS we have 1 lakh seats. In PG we have, I think one third of the seats, right? So even if you want to pursue a post graduation at some point of time, you will be not given a seat, and the exam is in Georgian language. You'll be stuck. And now the important and the most hilarious thing is the students who went to Georgia in 2022, 2023, and when they realize this fact, now the consultants and the people are saying, see, there is nothing in India. Why you need to come back to India? You go to USA, you go to UK. I mean, there's a beautiful dream for you guys to pursue. I mean, and the students are calling, sir, what if I was talking to a parent and I told him, see, sir, now everything is done. I will send my child to UK. I'll send my child to US. Okay, gosh. So that's how they're changing the narrative. And one beautiful narrative came from one of the biggest consultants that Anuj Bhai, if there will be 10 students who will come back to India after 5 years, they will fight for the rights in the courts. Will not have a very substantial case. If there will be 1,000 students who will file against the government, we will have a chance of winning the case. So let's send maximum students, to the abroad education, so that we'll have a bunch of students, a force of the student to fight with the government. Oh, beautiful, beautiful.
Left over the street. Actually,
Left over
left
the
over the
street.
street. Left over
Left
the
over
street.
the street.
Again, again, believe me, you have to work for them in Delhi. I have to work for them in Chennai, and then again we have to meet for this particular process, where actually we have not the actual cause, or we are the one who is actually not the cause and trouble for them. Now, one more thing, again, quickly. Even if you say realistically, let's say the students are doing 6 years in Georgia, forget about the ECT credits, 6 years in Georgia. Now, what is the duration for the internship after giving the exam in Georgian language? Because the Indian embassy, right, the message what I have received, they said very clearly the student should have a very sound knowledge of Georgian language. That's what they have highlighted very clearly, sound knowledge. Okay, let's say the student has actually taken the exam. Now, what is the duration after 6 years? Will they have to do an internship of 1 year or 2 years or 3 years to get the license?
See, the problem is two-faced. First is internship, right? So the internship problem is same like Russia. That integrated internship will not be acceptable. So if they say it is 5 years, they have to come up with a clear regulation that's a 5 year. They cannot hide behind the credits thing, right? They have to say every country there is a tenure. In India, it's not possible that some colleges say we have a 4 year education, some say we have a 4.5 year education. There is a standardized protocol and a procedure guidelines, right? Same with any country. It is just a clear manipulation to deceive or to hoodwink around the things. Number one. Number two, about the specialization, specialty, it ranges from 2 years to 4 years minimum, right? That depends on what specialty you are going for. If you're going for surgery, then definitely it's going to be higher, right? So, I mean, yeah, minimum of 10 years, so it's definitely there. 10 to 11 years will be there, definitely.
Then they already exit from the NMC Gazette point number 8, which is they say everything has to be completed in 10 years' time.
This 10-year thing, I believe, as far as my knowledge is concerned, this was introduced in next draft, national level exercise draft. This condition was there, which was withdrawn by the government, withhold it by the government. So as of now, there is a deliberation about this thing, right? So I believe because we have made representation, me and my colleagues, that how this 10 year is possible, right? You are pushing a student. This 10 year also includes, uh, next one, next
Internship,
two internship.
next exam, everything.
Yeah, yeah. So yeah, if you say 10 years by virtue of the Gazette, I take it that as a point. In the best case scenario, it has to be 10 years of education. That won't be possible in Georgia. So your education,
Oh, okay.
anyways, will be termed as a null and void.
But actually, like I don't know, I have what I have understand because when I have gone through the Gazette from my own view, I thought the whole Gazette point number 8 says very clearly that the student have to complete the duration and license to practice in the country of doing 1 year of internship, coming back here, clearing next one and next two, and everything has to be completed within 10 years. So that was what actually was in my mind from the day they join or the day they leave in from India, and 10 years down the line they have to complete. And for the domestic students those are studying within India, they have a regulation within 9 years.
Yes, yes, yes. You're very right. You're very right. So Georgia is a very, very complicated scenario. Not even Georgia, even Bosnia, right? They also have the same system. right? Even Belarus has used to have the same system, right? So whatever countries in CIS are claiming, right, except for one or two countries whereby there is a clear understanding, right? But the clear problematic countries are Georgia, Belarus, Bosnia. These are the countries which, in my personal knowledge, they need to have the post graduation education before before NMC will accept their education.
Or else they have to change the medical act, which should also have to be equally satisfying the domestic students of each nationality.
Yes, definitely.
Okay.
At par with
Now,
local citizen, they have to change it for both the local as well as the international student.
okay. Now, coming back again, okay, now we have talked about Russia, we talk about Georgia. Now, what is the other country was actually, again, giving a kind of a misleading information or misguided information for the students community from your point, because you sit in Delhi, and what from your point, which other country doesn't come under the same category?
Can you just repeat your question, please?
Okay, so apart from what we discussed about Philippines or Russia and Georgia, what are the other country which is actually also doesn't comply with the NMC norms, or the embassy is giving mislead information, or the country advisory gives mislead information to the students and the parents
See,
community?
you are landing me in a very very tricky situation.
No, no, no. This is,
Whereby
I'm not talking, see, I'm telling about the general information. See, again, I'll tell you very clearly, it is the individual students and parents' choice to send the children abroad, number one. It is their homework and their duty and their responsibility to collect the information in detail, because we always, as a service provider, we want to give the genuine information, what is actually being said, which country, which rules and regulations, whatever knowledge that we have gained so far, we will keep telling to the students and parents regularly. But there are people who actually had one agenda just to manipulate things or just to avoid things and then send the students and see whatever happen in the future, they'll face it by themselves.
see, I believe it is again not the fault of an agent or a consultant, because majority, I think more than 50% of the people now are not even aware. Day in and day out, we see in the groups the people who, apart from the mainline people who are connected, filing RTIs and everything, like you are there. Majority of the people who are working in the hinterlands, they don't have even an idea about the FMGL regulations also, right? We are educating. Even today, there are so many students who does not know about FMGL, right? They are just taking admission for the sake of admission, and the people are not being told also. The fault lies with Indian embassies, clearly Indian embassies situated in these countries, right? Because they are again and again changing the advisories, right? So I don't know. Again, if you want me to say, then I can say like one country again, which is a classic case, is this Tajikistan, right? So they have issued five advisories in concurrence in the last 3 years, and in every advisory they are coming up with as per this medical college. In the second advisory, as per this medical college and this medical college, and the third advisory after 3 months, as per this, and this medical college. Why are you referring to medical colleges? You are embassy. You talk in a right way that as per the medical council of Tajikistan or the health ministry of Tajikistan, who is the college to dictate you what are the rules and if they're following or not, right? And in every question, see what is the duration of medicine in Tajikistan? The answer is the duration is 5 year plus 1 year internship. For exact duration, you should talk to the respective universities about the duration. I mean, in the advisory, there is a note. What is the curriculum? You should talk to the university for the. The duration has to be the specific duration. Now, 2 days, 3 days, 1 month is not concerned. The point is, embassy is just keeping themselves away from taking the responsibility and issuing a contradictory. So let's say if tomorrow, if some students say, "Sir, this is not a 5 plus 1 year. This is clearly 6 year plus XYZ." See, we have already told you now that you should talk to the respective universities. How this university thing work actually in India? Can you say that some colleges in Karnataka they have a different university? I mean, education structure or the duration in some is different. No, so this is the very, very precarious situation, very
Standard.
bad situation. We have been writing to multiple stakeholders. Even right now, also I was writing to, some represent. I mean, people in MEA, Ministry of External Affairs, to see this what is happening. I mean, and it is not us. So many media houses has covered these stories, like Outlook, Times of India, clearly, which is read by so many serious viewers. And when they are writing, they definitely have a lot of substance while putting these questions forward. So, see, this is a general thing. For a student, I think in a personal capacity, you can tell them which country is better and let the student then. And my only advice is students should not take any call in haste. They should not take any call in hurry and just believing the face value of any person, any consultant. And especially, they should be beware or they should be very cautious from the student consultants, right? Because the student consultant is like, I went, I could not perform well, so I'm now a consultant. You also come in my say. So there were so many student consultants, they did not take any responsibility, nothing, and they just give you the very very shitty package. And the student gets attracted. My मेरे भाई ने मेरा admission कराया है, but he is the one who is taking the commission on your admission, and he'll doom you as a person also. So they should be very clear, and they should choose the right people or the responsible people with right knowledge while making the decision making process.
Okay. Now, one serious question, because I know that we've been talking personally on the chat, but let me ask you very in live about the Philippines Medical Act from 1959, and they're going to revise in future, which is like in the pipeline. From the lower court is being processed, and it's gone to the higher court, where the 24th Senate member is waiting. Maybe another 1 week or 1 month down the line, if this comes, what will be your opinion on Philippines medical education?
See, the best thing for any country to comply with Indian rules is to say that we follow these rules and not by embassy. It has to come from the respective ministry of that country, be it education, be it health. That what is our education system, right? In any country or most of the country, this thing is juggling between the embassies, and the respective universities are giving clarification that we are fulfilling. The best thing with Philippines is this is the only country which realize that there is a problem. They don't want to have so many people coming to them, right? That is not the intent of bringing this regulation or the amendment in the act. The main point was there were so many students who've taken admission in 2020, 21, right? Before the Gazette, they were retrospectively implicated. What will happen to them, right? It is not about the business or the commerce. It is about the responsibility that this country understood, right? The primary beneficiaries of this medical change will be that these students who were impacted by the NMC rules, many of them left their education. The one who left, now their pathway will be open. They can write the PLE examination in the future. Philippines is a beautiful country. Personally, as I started my conversation, the high population density, the exposure, everything is good about the climate, language, everything is good. But I think if the regulation is coming and they're making amendment in the medical act, it is something which is appreciable, and that will definitely create a boost. And at least there will not be element of doubt in the minds of a student if this complying or not. Because after overlooking everything, now they've made amendment in the act. So that is very important. It will be a very positive thing. It will be a very positive thing. And I think Indian embassy in Manila, they should also engage in this activity. They should collaborate in this activity. And definitely, I think students should be the beneficiary ultimately.
Just two things. Since you've been the senior consultant sitting in Delhi, two things I just want to. One, I've told you I met the Philippines ambassador from Delhi when he was in Chennai. I had a close conversation with him for 30 minutes. I was talking about the medical education system, why Indian students prefer going to Philippines. General details I've discussed, and I've also talked about this new medical act. But believe me, the ambassador, the new ambassador who sits in Delhi, he was thorough knowledge about the new medical act. So he was actually, he said that it has been already that being passed from lower court is being already gone to higher court. This is one side. Next thing that maybe next week or the following week, I have an appointment seeking in Manila to meet the new Indian ambassador because there's a new Indian ambassador that's actually now been taken over in Manila. So we are trying to get an appointment just to go and meet him to brief him what all the activities done because the ambassador when they change, they don't have an they don't have a previous situations or previous process what is being going there. So as from the South Indian side, I thought of I'm just seeking an appointment to go and meet the ambassador just to give a general information about this.
Yeah. I think there's some voice
No, no,
issue.
I can see you. It's just you've been freeze for about 10, 15 seconds. Now you're back. Maybe you would have been received a call or something.
Yeah, yeah. No, I think there is some voice. The voice is coming little low. I could not hear you properly. But yes, I
Oh,
could see that you were referring to Indian embassy, right? You are in interaction with the Indian embassy, right? So, can you repeat your question, please, once me?
no, no. See, my question is actually like I met the previous ambassador in Cebu last year. The Indian ambassador, I met them in Cebu. So I had a chance to break because see somebody I have to educate him on both the sides. So we were not talking about the medical admissions or bringing the students. Or, no, we were telling about the quality, the standards, the requirement from the NMC guidelines. Because when you talk about the ambassador, ambassador has various workload. They will not have everything in their own mind, but somebody have to have an access to go and brief and make them to understand. So
Yes.
now we're just trying to get the new ambassador's appointment with who was just taken over in Manila, the new ambassador. So if we have a chance, I just represent from the on behalf of all the South Indian education consultants who promote for Philippines and on behalf of all the students, we just go and tell what is the current situation in Finland, just to give an idea or an awareness. Because
Yes.
ambassadors, as you know, that he works from country to country, they have bilateral arrangements, so many things in their mind. So, but for us, the student is the most priority because they are the one who trust on us, they are the one who believe on us. The parents have the faith and trust on us. That is the only reason we thought we will continue to give our support and service and voice over to students wherever they had difficulties. Like for example,
Yep.
for
Yeah.
example, like you know very well, like when we had the war, Ukraine war, when the students had problem, we had a voiceover. We tried to support. We had so many meetings. When the COVID time came, the China students returned back to India. They're not able to go back, so we had a lot of difficulties with NMC, the State Medical Council. We helped. So it's not that we're like you and me, like we are not just taking care of only for our students. When the students has any common difficulties or issues, we always raise our voice from our point of angle, how we can actually to help the children to make sure that they go in a smooth process or seamless process.
Yes. 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 Nee, see, as you rightly said, this on the web. Sorry. As you said, embassies have so many things to do. With respect to Philippines, one issue that is also coming is about the visa thing, right? So embassies are the primary focal points, right? They are the felicitators for the overall student well-being or a person well-being, right? And if they are kept in loop, or if they are very positive, if they are very collaborative about this thing, I think it gives a lot of confidence to the student also, right? That whatever problem we'll have, our embassy is the only guardian of our student interest, right? So
Access.
yes, yes, yes. So, and it comes both the ways from Indian side also, the embassy representing India, and also from the Philippines embassy in India, right? So, if this system works well, then definitely the communication system works well, the advisories, and the student feels protected. Morally, he feels protected. There is an embassy. So, if embassy is saying something, because ultimately, what we'll believe the the aspect of Indian embassy, right? So, I think, yeah, good.
Maybe like once I have a meeting and come back, definitely we will have one more live chat because you know what? We have spent almost 1 hour in the live. You know that time flies. Even when I'm talking to you or chatting, the time flies. But in the live time, first we are doing a live show and we already crossed almost 1 hour.
I could see some comments like students are asking like which country comes under NMC guidelines. See, we are again back to the square one, right? That what is the answer to this golden question that which is the country which is complying to the NMC guidelines, right? I believe, like answering to this question, I believe if Philippines, as soon as the Philippines medical amendment is passed in official capacity, uh, then yes, that is one of the beautiful options that can be looked into, right? Bangladesh is second option that student can really look for. Technically speaking, China is fine, but the only issue with China is the licensing exam is in Chinese language, right? So
Very
for the
difficult.
students who have audacity or who have a clarity that they can do it, the Chinese language, which is considered to be one of the toughest, technically, I'm talking about the technical things, right? Then China is also okay with that thing, right? Personally speaking, I've seen Uzbekistan also, right? And there's a lot of people I've met there. So the licensing team is also relaxed over there. There are doctors who are working, and there is no specific licensing exam. So the people who are looking for that region, then yes, that is also a potential option, and they are open of making amendments to the education system also, as in when it is required. Okay. Uh, a no-no is definitely Georgia. A no-no, I mean, that is a one no-no that I clearly see.
No, I would say big no no. If you see
A
me
big
in
no
person,
no. A big
a
no.
big
See,
no.
there is always a priority list, right? In personal, my priority, that is a big no no, because that is very clearly written, and there is no effort being made to change or amend. At least in other countries, there is an effort which is going around. Georgia is sitting in such a situation in between Europe and Asia, and with the internal treaties, and in spite of they want, they cannot do it, right? So that is a general guidelines for the students, which they can, probably discuss, and they can, look forward.
And anyway, you have any questions to ask from my side? I've
How do
been
you get this?
I've been interviewing you. I've been asking several questions, and you've been very kind and answering all these things. You have any questions to ask from my side?
My only question is, how do you get this kind of beautiful energy from, right?
See, the inspiration, I don't know whether you've seen my chart, personally, my chart. I always say that inspiration is people like you. When I see youngsters like you running around, that's what motivate us also, correct? That's how this energy is actually certain.
See, from, I just speak last thing from the consultant point of view. We are not just counselors, or we are not just people use agents. I feel so derogatory when people use the word agent, right? We are into education, and education is such a pious thing, right? We have a lot of responsibility. you know we are shaping the career of a child, right? So we our responsibility does not end just by virtue of passing the visa regulations or getting assisting him in the visa. Our responsibility is in helping him in shaping his journey across till the time he's completing his this education. Even the students come to us for the post graduation or the PG education assistance, and they're connected. So many students are connected for so many years with us, right? It is a mentorship. It's a bond between. It's a guru shishya parampara, right? Just I believe that every consultant, you know at times, I don't understand what is the motivation of earning the dirty money, right? You earn money, but you earn good money, you earn clean money that will give you a satisfaction, right? So I am of this belief, frankly speaking. I have limited requirements, and by virtue, I am satisfied. And I believe that people should realize this consulting business is one of the best pious profession that you are being drive to. So let you not compromise on this thing. If you're not educated, educate yourself, right? But don't do injustice to the students just to make some extra bucks. Because if these students will lose their career, they will not lose their career on money, they will lose their confidence of living, or they will lose the aspiration of living, right? This is a very, very big thing that really give me shivers when I think about these things. And we know how NMC works,
I,
right?
I
For
have
them,
gone,
for
I
them,
have
yeah.
I have gone through the same thing. Probably like as you like my younger brother, I can even tell very clearly. I tell all my office people, all my office people, everybody. This is the where the parents believe with faith and trust on us. Number
Yes.
one. And whatever we call it as a remuneration or a honorary commission that we're getting from the university for our service is being taken. I've been taking for me personally. It's not for me. I'm taking care of my family, my parents, everybody. So even every meal, I have to thank all the students, those who are trusted on us. Every meal before I start my meal, I pray and thank. That's how actually we've been brought up. But when I say like when we have a good heart people like you, us, and we have a like-minded people, definitely we will fight or we will raise our voice throughout our journey. As long as we have energy, we support each other. Definitely we will be there for the students and for the parents. No doubt about it.
Yes. And I really wish that our energies and our motivation, keep us intact like this only.
No, definitely. See, our meeting, like we don't meet quite often, but at least we have a chance to say hello. You are busy in your own side, and I'm busy. But still, next time we should meet for a very good cause, not like again challenging or difficulty or all these things. At least we should have a cup of coffee in a peaceful mind. But definitely, for sure, that there will be some sort of positive that we are working out. But let's say when time comes that we will have one more live session.
I will eagerly wait for this live session to come up, right?
No, definitely not too far. But first, I have to thank you because you've taken your time. And I messaged you, said you're busy. Then I requested you at least give me 1 hour time, and you're given 1 hour time. I know that you're getting calls. There are students are waiting for you for counseling. But again, thank you so much, Anuj. I can say Anuj Bhai because very close people. I always say this word called Bhai. Like I feel like my brotherlyhood. So I have to thank you again taking time. At least this 1 hour session, the students or parents, those who've seen this video or those who are going to watch this video, they will have some sort of an idea as saying that how to select a country, what is the requirement. We talk about like various issues and fact and everything. Talk about. Good to see you, and definitely we will have one more session very shortly with you. Bye.
I will definitely look forward for it. Eagerly and
Right,
enthusiastically.
right. Thank you, and good to see you. Thank you.
Thank you,
Bye,
Mannequin. Thank you. Bye.
bye.